Hi, my name is Ruth, and I am 37 years old. And I'm actually sitting in the ward at the moment after having a skin cancer lesion cut out of my forehead. You can see over here. I actually have previously had this exact lesion in the exact same place cut out. I noticed that I had a spot that was just not healing. It would kind of become a bit of a wound and it would become a scab and then it would halfway heal and then it would get all kind of a wound again. So eventually I went and asked my doctor about it, and he referred me to a plastic surgeon that cut it out and sent it for histology, and then told me that it was a basal cell carcinoma, which is one of the many types of skin cancer. And when the plastic surgeon cut it out, he actually told me at the time that they suspected that the borders were not clear of skin cancer cells. So he told me there was a good chance that it was going to recur, and it did. I started having the exact same issues. Again, it just wasn't healing. The skin was incredibly fragile and it would just open up the whole time. And I went to my general practitioner, and he then told me about the Mohs procedure, which he had actually had himself. So that was the first time that I found out that there was a different way of cutting skin cancer out that had a much higher rate of success. And which brings me to where I am now. I then got referred to a dermatologist, which was Dr. Ramlachan, and we're at the Club Surgical Centre at the moment. And I've just had the first stage of the Mohs procedure done, which is where they cut out the lesion. And I'm currently back in my ward, sitting in my bed, and Dr. Ramlachan is looking at the sample. And the way that they do it differently to the first time that I had it done is they actually look at that entire sample that they cut out here. So instead of only looking at 3% of it, as they previously used to do, they look at the entire sample to make really, really sure that there's no skin cancer that they've left out. And if they find that there is some skin cancer right on the border that they might have left behind, you then go back into the theatre and they cut out a little bit more, and then they check that part that they cut out again, and you wait in the ward again. And then once they're happy that they have actually gotten all of the skin cancer out, then a plastic surgeon comes and closes you up all nicely. So I'm kind of like maybe 1/3, maybe 1/2 of the way through the procedure. We'll just have to find out what the histology is of the sample that got cut out of my forehead. My suggestion is to really get checkups done as frequently as you possibly can. The reason why I say you should have it done as frequently as possible and go and do it as early on as possible is because the longer you leave it, the more of an issue it becomes, the bigger the thing might become, the more it might penetrate into the surrounding tissues, and then it becomes more and more of an issue to deal with it. But if you catch things really early, then you've got a much better chance of actually getting rid of all of it and not having to deal with that problem again. I do have a history of skin cancer in my family, so I knew that skin problems were likely for me, and I definitely should have been a bit more proactive about going and getting my skin checked when I was younger. And the other thing that I think is really important that I also didn't do when I was a kid is sun protection. Now I really, really go crazy with sun protection. I make sure that I always have sunscreen on if I'm outdoors, and I always wear a hat. And I also tell the people around me to wear sunscreen, because the sun can obviously cause a lot of skin damage, and that can also lead to skin cancer. But if you do have skin cancer, or if you have a lesion that you suspect might be skin cancer, it's not going to go away if you ignore it. Please just go and have it checked out, especially if you come to the Club Surgical Centre or the dermatologists here. They are so wonderful and friendly. It is not scary at all. Everybody here is geared up for caring for the patients, and once you've had it removed, there is an extremely low chance that it will recur. So then it'll just be done and dusted, and hopefully you won't have to deal with that again.